Good morning and welcome to the Idaho State University Physician Assistant interview series, Experience Speaks, preparing PA students for rural practice, where we take the opportunity to visit with a PA or a physician or other provider who has worked or is working in a rural community and learn about what it's like to work in rural medicine. Today, we're honored to have with us PA Dave Martin. And Dave, why don't we start by having you share a little bit about yourself?
Well, thank you, Jared. I'm Dave Martin, a physician assistant. I've been a physician assistant since 1980, so 43 years. And I've been in Idaho that whole time. Prior to becoming a PA, I was a Navy corpsman for 5 years. So I've had medical experience since 1973.
Very good. Thank you, Dave. And what influenced your choice in becoming a rural medical provider?
Well, I wanted a job. It was about that simple. And back in 1980, jobs weren't nearly as plentiful. And I managed to find a job in Chalice, Idaho, a town of 1,000. I had never lived in a rural town ever in my life, but I found a job and moved myself, a wife, and 2 kids to Chalice, Idaho, 3 hours from a city. I've never experienced that. And it was a total culture shock in a very good way. Learned to love it. And I've been in love with rural Idaho ever since.
Great, thank you. What did you love about your rural practice there in Chalice, and where else did you practice rurally?
Yeah. So I was in Chalice for 2 years, and then I was in Salmon, Idaho for 21 years, a town of 3,000. And then I moved to Pocatello, bigger town, and the ISUPA program hired me on to teach. I'd been having PA students to precept for many years, and when ISU came on board, I was having many of their students, and the program invited me to come teach full time. But even though I live in Pocatello, I still work in rural Idaho. I go up and cover the Stanley Clinic every August for a week. And over the years, I've also done fill-in work for Chalice until their medical provider situation got stabilized a number of years ago.
Very good. And I think you mentioned that the background you have there today is actually of Stanley. Is that correct?
Yes, this is outside of the town of Stanley. Stanley is a very small town, about a population of 68. The nearest facility medically is over in Sun Valley, Ketchum, which is about 70 miles over an 8,200-foot mountain pass called Galena. It's right on the Salmon River. And this picture you're looking at is up by Redfish Lake out of Stanley, up a trail called Fishhook Creek Trail. And I'm standing on the edge of this meadow looking out and the sign right there says wilderness. So I'm on the edge of the wilderness looking out into this beautiful meadow.
Yes, a beautiful picture. Uh, so what are some of the rewards of working in rural communities like you have?
Well, it's a challenge because you're taking care of people without a lot of resources, potentially, depending on your facility. In Stanley, there's a clinic, a receptionist, and now they actually have a nurse. They didn't used to have a nurse. It's just a receptionist and a PA. In Chalice, the PAs run the clinic there, and there's no doctor. In Salmon, it was different. I had doctors that I worked with. It was a hospital. And so it's challenging to take care of people in those locations without a lot of resources. And that's actually part of what I enjoyed, that challenge to do a good service for people, and you don't have a lot of resources.
Very good. Tell us a little more about some of the connections you are able to make when you're working in a rural community.
Yeah. Well, you get to know the people in the town real well, and they get to know you, and maybe that's good and bad, but I think it's mostly good to develop those good relationships with people in the community. Your family, kids, whatever, become well connected to the people in the rural community. They look at you as a valuable resource in the community, as a medical provider. So I really enjoyed that. I didn't have that sort of connection growing up because my dad was in the Air Force, I was in the Navy, we moved a ton. And so I really felt for the first time being in Idaho and rural Idaho that I could develop good relationships with other people and have friends, if you will. So that was really, really great.
Great, thank you. So if you were speaking with some new PA students, what would you advise them as far as a set of skills or knowledge they should have to be a successful PA practicing in a rural area?
Well, I think, and we stress this all the time in education, is history is the key to taking care of patients. Be able to take a good history, do a good physical exam, because sometimes resources are limited. You can't get x-rays right away or lab work, and you have to rely on your clinical skills. So being skillful at taking history, doing a good physical, and being able to do that well, know what you're doing. And you can always call and talk to people also for advice. Like in Stanley, where I cover in August, there is no x-ray. There is no other help. There is no pharmacy in Stanley, no drugstore. The drugstore for Stanley is, there's 2 cupboards in the clinic that has some medications to dispense. And so if you want tests, you want x-ray, you want more medications, you may have to send the patient out of town. Resources in a place like Chalice are a little better. They actually have an x-ray unit and limited lab. In Salmon, it's a lot better. You have x-ray and you've got the hospital there. You can get much more in the way of lab work. Up until the time I left, we did not have a CAT scan, and now they have a CAT scanner, which is nice. So getting back to the basics, good history, good physical, gaining experience. It's nice to have mentors for sure in those areas. If at all possible, it'd be tough, I think, for a new graduate to come to a frontier area like Stanley out of school. But as someone gains more experience, that's great. In Chalice, there's some other experienced PAs that would help mentor a new graduate. Same in a place like Salmon, great place to get mentored.
Very good, great. It sounds like working in a rural community really allows you to expand your clinical knowledge and skills, and coming in with a good skill set of take a good history and evaluate patients is really key.
Well, that's a good point, Jared, because I can't, in those rural areas, you can't just easily send a patient to a specialist. Like in Salmon, it's 3 hours to a referral facility, and it may be winter. You can't just send everyone out to a specialist all the time. Folks can't travel many times in the winter. And so you end up taking care of a huge variety of patients, and you get skillful at that. You really learn a lot. and you can consult with specialists by talking to them on the phone, but it really boils down to you taking care of them, whether it's in the clinic, the hospital, the emergency room. And many times you're the front line, taking care of people on the worst day of their life with an emergent situation. Also in these rural communities, it's very common for physician assistants to be involved with first responders, emergency medical services, teach EMTs potentially, maybe even ride on the ambulance with them at times.
Yeah, that's great. That sounds like that's one of the wonderful things about rural practice is you get to experience a variety of things and be uniquely involved in the care of the patient in a variety of ways.
Right.
Thank you, Dave. As you look back of your years of working in rural communities, can you think of a moment or experience where you just felt like, I really enjoy doing this. I really like being in these rural communities?
Yes. Maybe a couple experiences, and these were emergency situations. I remember a gentleman was in the emergency room in Salmon with his wife. He was having chest pain, and he went into cardiac arrest right in front of me.
Mm-hmm.
I had the defibrillator there. I was able to fire up the defibrillator and shock him. He immediately came around with a heartbeat. We were able to get him transferred out. He had had a heart attack. And some odd months later, I saw him and his wife, and they were so thankful that I had taken care of them, and they had a great outcome. One of my best friends, a nurse, his son was in a horrible traffic accident as a teenager. Came into the emergency room. I took care of his son and actually knew the son very well,
Mm-hmm.
which makes it sometimes difficult, but he was in severe shock. It's the worst pelvic fracture I'd ever seen. We're able to take care of him, get him IV fluids, blood, splint up his pelvis and fly him out. And he's now approaching 30 years old, has his own family, and is doing well. And so that's very gratifying that you can make that kind of difference in the life of the people in a rural area. And sometimes the people you know real well, which makes it sometimes hard, but also very rewarding.
Thank you for sharing those experiences. Yeah, it sounds like working in a rural area really allows you to connect with individuals and people and make a significant difference for them in their lives.
Right. Another thing that I would like to point out in a rural area, especially if you're there for a number of years, is you get to know a child and their parents. And then the parents get older, the child grows up, has kids, and then you know those kids. And you may be taking care of a family with 3 generations, and you know the whole family and the dynamics of the family. They know you, they trust you, and that is just really, really neat.
Yeah, that sounds priceless. Well, Dave, we want to thank you for taking the time today to sit down with us and talk about what it's like being a PA in a rural community. This concludes our episode of Experience Speaks, preparing PA students for rural practice, spotlighting on rural primary care. We hope you enjoyed today's discussion with PA Dave Martin, and we hope that you'll consider pursuing an opportunity to provide care in a rural community. This concludes our interview for today, and we again thank Dave Martin, and we hope to see you at another interview in the future.
Thanks very much, Jared.
Welcome. Thank you.